Welcome! In this explainer, we're going to tackle a really crucial clinical skill: how to estimate survival in patients who have advanced cancer. We'll take a practical look at the data and, more importantly, the tools you can actually use to handle these tough situations way more effectively.
Okay, let's just dive right in by starting with probably one of the most frequent and, frankly, one of the most challenging questions you're ever going to face in your clinical practice. It's a question that really shapes everything that comes next for patients and their families.
So, there it is, the big question. And your answer, whatever it is, has profound implications for treatment, for planning, for everything. But here's the problem. Study after study shows that when we rely only on our clinical gut feeling, our estimates can be systematically and pretty significantly off the mark.
To really see this in action, let's walk through a key study. Researchers went to physicians and asked them for their confidential, best guess on a patient's survival. The median estimate they came up with was 75 days. Okay, but then they asked a follow-up question. What timeline would you actually communicate to that same patient? Well, the response got a bit longer. The median communicated prognosis jumped up to 90 days. And this is where the paradox just smacks you in the face. The patient's actual median survival wasn't 75 days, it wasn't 90 days, it was only 24 days. This reveals this huge gap between our best estimates and what's really happening.
So the crucial point here is that this isn't just random error. It's a consistent pattern of overestimation. Researchers call it an optimism bias, and it has really important consequences because it can seriously impact a patient's ability to make fully informed decisions about their own life.
All right, let's move on and see how this tendency to overestimate actually shows up in our conversations with patients. The data points to a really clear gap that we as clinicians just have to be aware of. Now, what's so wild about this slide is the disconnect it shows. You have a huge majority of patients, we're talking 71% in this study, who say they want to discuss their life expectancy. But then look at the other bar. Only 18% actually remember having a conversation like that with their doctor. And all of this contributes to what's known as the prognostic awareness gap. As you can see from this chart, fewer than half of patients with advanced cancer actually have an accurate understanding of their prognosis. That means the majority of them could be making huge life decisions without a key piece of the puzzle.
So, to get more accurate and to help close that gap, we need to add something to our gut feelings. We need objective, evidence-based predictors. Think of these as the building blocks for a much more data-driven prognosis.
Across countless studies, the single most powerful predictor is the patient's performance status. And in simple terms, all that is a standardized way of measuring a patient's ability to just carry on with their daily life. The first common scale you absolutely need to know is the Eastern Cooperative Oncology Group score, or ECOG. It's super straightforward, just a 0 to 4 scale. A 0 means they're fully active, and a 4 means they're completely disabled. It gives you a really quick, useful snapshot of their functional level.
The second key scale is the Karnofsky Performance Status, or KPS, which is on a 0 to 100 scale. Now, the crucial clinical pearl here, the thing to remember, is that a KPS score below 50 is a really strong prognostic red flag. It's consistently linked with a survival of less than 8 weeks. Okay, so beyond that general performance status, specific clinical signs are also highly predictive. As you can see on this slide, if a patient has a symptom like dyspnea, shortness of breath, we're now talking about a median survival that's measured in weeks, not months. Now, these individual predictors, they're powerful. But their real clinical magic happens when we integrate them into validated prognostic models that give us a much more robust and complete estimate.
For your day-to-day practice, the most important tool to get familiar with is the Palliative Performance Scale, or PPS. It's really the most widely used and validated index out there for patients with advanced cancer. The strength of the PPS is that it combines these 5 key areas. So instead of just relying on one data point, it creates this composite score that gives you a much more holistic and, frankly, more accurate survival estimate by looking at multiple areas of function. So, while the PPS is your main go-to tool, it's helpful to know about a couple of others for specific situations. The Palliative Prognostic Index, or PPI, is especially useful for very short-term estimates. We're talking days to weeks. And the PAP score is kind of unique because it actually pulls in lab values to calculate a 30-day survival probability.
So we have all these evidence-based tools that are much more structured than just relying on our intuition.
But what's next? You know, as big data and machine learning become more and more common in medicine, is technology just going to automate this whole skill set?
You know, machine learning definitely shows promise. It can synthesize these huge data sets from electronic health records. But the studies we have right now suggest that for prognostication, AI models only offer pretty modest improvements over the tools we already have. I mean, look at this example. One study found a difference of just 1 percentage point in accuracy. Plus, the whole black box problem of not knowing how the AI got its answer is still a real challenge for using it in the clinic.
So what's the bottom line for your practice? It's this. These scores, these models, they are not a substitute for your clinical judgment. They are a powerful enhancement to it. They give you an objective anchor for your assessment, which you then combine with your complete understanding of the patient as a person.
And this really brings us to the final and most important takeaway. Getting a more accurate prognosis isn't the end goal. It's the beginning. It's the foundation that allows you to have clearer communication, to have better informed shared decision-making, and to provide care that is truly aligned with your patient's goals. The data gives us a framework, but our job is to use it to provide the best possible care we can.